Okay, this is still skill 1, but this is for rescuer 2. Again, I encourage you to learn them both as you're going through the CERT training, and might be something that you would want to know. But what I'm going to do here is show you skill 1 for rescuer 2. And so at the same time, you would both be doing your personal protective equipment. You would verbalize the full helmet, goggles, N95, gloves, boots, etc. You would both together decide to survey that the scene is safe, and you're both going to be awarded rubrics on the separate, or points on the separate rubric for that. Okay, so rescuer 2, you're going to get points for that. Rescuer 1's going to get points for that. So make sure you're both saying it so it's easy to give you both points for that. And then you are going to go to the patient with uncontrolled bleeding. This might be done a little more discreetly with what we call moulage, which is a fake blood looking thing going on. So look for that. Obviously, the person with the airway is going to have an airway mannequin or patient. And again, ahead of time, you guys might decide, oh, I'm going to be the person who opens the airway, and you're going to be the person who goes and works on the bleeding. But you might come to the wrong patient, right? Because it might not be obvious. And so you want to make sure that you both know how to do both skills so that you're ready for whatever patient you can get is the advice that I would give you for that. So if I come up to this patient, my personal protective equipment's on, my scene is safe, I identified and found the patient with uncontrolled bleeding, and I'm going to identify myself. My name's Katie. I'm with the billing CERT team, and can I have permission to help you? And they would verbalize, yes, this might be an awake patient, it might be a mannequin, kind of depending on what's going on. Remember, this year we're hosting at City College, so we're going to have use to mannequins. We might have use of college students to simulate patients for you guys and act that out. So it could be a human talking to you. And so we always want to try to control bleeding first with direct pressure, so you can use your gauze bandages that you have in here. I have a small ABD dressing here. Do you want to see what that looks like as you're doing your kits? Remember, I did put together for you guys a Montana Gotta Have It list and kit where you can find all the supplies that you need and a shopping list, so you can see what that looks like to make sure you're ordering the right equipment that you are required to bring. So this would be in your first aid stuff. And I'm going to go ahead and say that it's on his arm, or his upper arm. So you can open this up. I'm just not going to waste this in my costume use. And apply direct pressure on that. And when you do this, you're putting your body weight on that, okay? You're putting your whole weight. I just kind of leaned back because I was just looking at that rubric one more time to make sure I'm not missing anything I want to tell you. But you're putting your full weight on there. You're going to be talking to your patient as you do this to let them know that's going to hurt, and giving them all kinds of information like that. The judge will then tell you that that is not working, that the wound is still bleeding, and that you're waiting on EMS to get there. They are delayed. So you are going to need to use a commercial tourniquet. This is a cap tourniquet. This is a style that will most likely be available to you to use. And the judge will tell you where and how we're going to put this on. So this is a mannequin. You can put this on the mannequin arm. If it's a human, we'll likely give you a pool noodle. It'll be sitting beside the patient, and the judge will prompt you to put this on rather than putting this on our live patient over and over again. I'm going to put this on myself as a live patient so you can kind of see a little bit about how these work and give you a little bit of a tutorial. So I'm breaking a little bit from the rubric here because I want to make sure you guys have the training on how to use a piece of equipment like this. And so the rule that American Heart Association gives you with this and stop the bleed is to use it 2 inches above the wound. I like to go higher than that. So if it's a lower arm or leg wound, I don't love it because you have 2 bones here as opposed to 1 here. And it makes it easier to get that circumferential tight around that blood vessel when I go around the singular bone rather than the 2 bones. And if I'm limited on my resources and only have so many of these, I want to make sure that it's going to work. Because the rules with these are once they're on, they don't come off except for from a surgeon. So I don't get to take it off if I think it's working. I don't get to take it off if I think I put it on too loose. I don't get to take it off if I want to move it higher. Once it's on, it's on. And so sometimes you can use more than one. So if this one I put it down too low and I couldn't really get it tight here with that, I could put another one on above. And so I like to go ahead and put these on high and tight right away. So you can go ahead and then put this on. It says, so the steps say to obtain a commercial tourniquet from the supply bag. And they do, even on this, say to place it as high as possible, which again is how I prefer to teach that. So this is going to go on as high as you can. So on the arm, I'm getting as high up into that armpit area as I can. If I were to do the leg, you're coming up into that groin area as tight as you can get this. So you might need to lift their leg or shimmy this around a little bit to get this on there. And then this part goes as tight as you can pull to begin with, okay? If you have to spin this piece here called the windlass a lot, you don't have it on the first as tight as it should be. So get that as tight as you can, okay, on that rubric. And then I'm going to pull it through the buckle because this is a long tail. If I'm dragging my patient and I'm trying to move them in those emergency moves that you guys have learned, I don't want this coming off. So I'm going to tuck this through this buckle and get it out of my way a little bit. Okay, and then it asks you to go ahead and talk to your patient, let them know that it's going to be tight, it's going to hurt a little bit, and you're going to twist this rod called the windlass. You're going to twist this rod as tight as you can get it. Okay, and again, you shouldn't have to spin this very many times for it to go, and then it's going to lock in place inside there, like that. And then this will go over the top and help secure it on there. And that's what they have you do on the rubric. On real life, there's a spot to keep track of time on here for how long this has been on the body. But they don't have you do that step, so you could verbalize that if you want. And you can see, even without me doing it super tight, a difference in constriction there on my hand a little bit. Sorry, camera work. I'm using a robot in case you're wondering why it's moving and why I'm not wearing a mask with somebody filming me, but it's a little robot toy. So that would be getting your tourniquet in place. I'm going to go ahead and take this off myself. But remember, you'll either be applying that to a pool noodle or to a mannequin, and it could be an arm or leg. So once that's on, they'll let you know that the bleeding has stopped. And now we want to look for signs of shock. So shock means that your patient is moving from aerobic metabolism to an anaerobic metabolism process. And if you remember some of that from biology, in anaerobic metabolism, we produce lactic acid and pyruvic acid as a byproduct, which can be really dangerous to your patient, and eventually is going to send them into organ failure, which is what they would die from. And so if your patient's in anaerobic metabolism too long, that's what they would die from. They'd die from shock, is what we call that. And anaerobic, remember, means without air. And so anaerobic metabolism is happening when your patient isn't able to either take in enough air, which is why your first patient for a life threat opened that airway, and why if you can't circulate the blood, so if you can't bring air to your lungs, and if you can't pick that up with your heart and circulate it, your patient can't get oxygen. So a lot of times patients who have heart troubles might go into shock, patients who have airway problems, patients who have bleeding problems, among other people, can have shock. So in EMS and emergency stuff, we're looking for those things. So you're going to assess for shock for your patient. And so you're going to check a couple of things. You're going to check how they're breathing. So you can put your arms here on their rib cage, okay, and feel for breathing. And you are going to let them know that you're looking for rapid and shallow breathing. The judge will let you know whether or not you have rapid and shallow breathing, either a yes or a no on that. So that would tell me how well they're getting oxygen for that shock piece as I assess for this. I'm going to check capillary refill. Some people check it on your fingers, and when you just press on that, that color should bounce right back within 2 seconds as an adult. In Montana, this is a little funky with our cooler weather that I think fingers are hard to see. So I like to check cap refill like here on a sternum, and that bounces back almost immediately on me as an adult. And so we're going to count that amount of time there again for a healthy adult who is not in shock. That should be less than 2 seconds. So if your patient is having trouble breathing, and the fact that it's fast and shallow, and or they're not having good capillary refill, meaning it's taking more than 2 seconds, they are going into shock. The third thing that we can check is their ability to follow commands. So I might ask them to show me 2 fingers on their left hand, follow some kind of a command. And again, that would tell me how much oxygen they're getting to their brain. So I'm looking at 3 things: their breathing, their circulation, and their ability to follow commands as far as that coming to their brain. If they fail any one of those 3 things, they're likely going into shock, and we want to treat for shock. As a CERT skills person, there's not a ton that you can do for shock other than fixing the problem, so opening the airway, stopping the bleed. But we can administer oxygen and do some of those things. So the best things that we can do is leave them supine. Old school used to say to do a position where we kick their feet up. We no longer do that. So don't kick their feet up. It actually can cause more damage with spinal cord stuff and that kind of thing. So leave them flat. But we do want to keep them warm. So your rubric kind of goes through some steps that you could verbalize ways to help maintain their body temperature. So if they had wet clothing, so maybe your scenario is that they were in a boating accident or they were in something, we would verbalize that we would remove any wet clothing from them. That we maybe get something underneath them. So maybe we find boxes, maybe we find blankets so that they're not laying on the ground. Again, as an EMT, I would transport them, but you're waiting in that environment for emergency services to come as a CERT person. So you're going to get something so that the ground's not radiating up and giving them cold air. We are going to wrap them in layers. So you're going to find things in the room, blankets, coats, etc., and cover your patient to keep them warm. Again, if there's not something in the room, you would just verbalize that step. And then try to shield them from the wind. So if we can move them around something, if we can physically block them and get them out of the wind, because those are all the ways that the environment chills our patient. And in anaerobic metabolism, if you remember from, again, your biology lessons, aerobic metabolism produces heat as a byproduct, right? We get ATP, we get water, and we get heat as a byproduct. Well, if they're not able to do aerobic metabolism because they're bleeding out there and don't have that hemoglobin from their blood, and they're relying more on anaerobic, they're not producing as much body heat. So that's one of the reasons we want to keep them warm. Plus, they might have lost body heat from their wound. And so all the more reasons to keep them warm. And again, ideally keep them flat so it's easier for their body to circulate that blood around. So those are your pieces for Rescuer 2. Again, I would make sure that you know them both because you don't know what patient you're going to stumble across first. So Rescuer 1 and Rescuer 2, you're both treating life-threatening conditions, opening an airway or stopping bleeding.